Good morning, everyone. This one is the last lecture about diagnostics, and in this one, I'm going to discuss arterial blood gases. Actually, I forgot, like in the start, I told you, like I'm going to talk about this one, not in too much detail, but from diagnostic point of view. So that's why, like, I included this lecture as well. So ABGs is a very important investigations. Basically, this one is arterial blood gases. So remember, they take the blood from an artery, but for the rest of the investigations, usually the blood is taken from the veins. So in this one, the blood is taken from the arteries. But there is, like, in the emergencies, there is one more test which we do, which is called as VBGs, or venous blood gases. So basically, the correct way is to do arterial blood gases. Now, arterial blood gases, or arterial blood gas analysis, which is also short written as ABGs, or arterial blood gas analysis, right? Uh, this one provides a lot of information about the patient's state of health. And of course, there are some indications in which we go for this testing. Basically, this test is used um, most commonly in acute illness, but uh, illnesses, okay, like most of the time it is done in emergencies and acute illnesses, but it can be done in patients who have chronic respiratory conditions like COPD, okay, chronic obstructive pulmonary disease. So in acute situations, what happens, uh, this one provide a lot of information about the level of oxygen, the level of carbon dioxide, either there's any acidosis or alkalosis, and what is the level of the bicarbonates. So you can say, whenever we order ABGs, they tell us few of the things. The first thing they should tell us is the pH, and then they tell us the partial pressure of oxygen in the blood. So these two things. After that, this test tell us what is the partial pressure of carbon dioxide, dioxide in the blood, and also it tell us what is the level of the bicarbonate HCO3. Okay, so the bicarbonates. So now, guys, like, to understand this thing completely, you must have a very good, not very good, but at least a good concept about acid base balances or imbalances, like what is acidosis, what is alkalosis, what is respiratory acidosis, what is respiratory alkalosis, what is um, metabolic acidosis, and what is metabolic alkalosis. Of course, like, the lungs and the kidneys are the most important organs which play a role in you can say, uh, in maintaining these balances. So whenever we send the level, to the labs, ABGs, and they give us these values, okay. Um, Sometimes they also give more information called as um, base access. Okay, base access. Sometimes they give as well. So now, just for reference, by the way, like, the normal pH of the blood is between 7.35 to 7.45. So anything below this is acidosis, whereas anything above that is alkalosis, right? And the normal level of partial pressure of oxygen in the blood is uh, 11 to 13 kPa. The normal levels of carbon dioxide in the blood is 4.7 to 6.0 kPa. as well as the normal level of bicarbonates in the blood is 24 to to 30 millimole per liter. And base excesses or anion gap, sometimes they also give us. So now, it's, by the way, it's important to learn, uh, the normal values, because these are, you can say, something important. So, and ABGs are very commonly done. That's one of the reasons. So, same like CBC, you can find a lot of ABGs report. Okay. And most of the times we encounter this ABGs results in emergencies, right? Or you can say under stressful conditions. So that's why it's better to memorize the values, right? So now important thing is uh, the oxygen levels in the air. Of course, like they are not same everywhere. For example, if you're living in at sea level, or if you're living on a mountain area, like what, there is a city called as La Paz in Bolivia that is like very highly located. So of course, like the people living over there, they are in, you can say, uh, oxygen deficient region. Okay, so remember this thing, like increasing altitude, uh, altitude uh, will, or oxygen levels fall in the air. Okay, so we must keep this thing in mind, whenever we are interpreting the ABGs. So that's an important thing. So it depends on like which area you are living, right? So how we interpret ABGs now, there are two steps uh, whenever we assess like ABGs. Of course, like first of all, uh, or you can say like two steps for interpretation. The first step is to uh, assess oxygenation. And the second step is to assess the acid base status. So now we know like how we can assess the oxygen. If you will see over here, I told you the normal values, right? This one. So the normal value is like between 11 to 30, and remember, like this value is for the patients who are breathing at the room air. So if you know like how much air is oxygen is there in the room air, like the air around us have 21% of oxygen and rest is nitrogen. So this is the level for someone who is breathing in a room, breathing the room air with 20% of the oxygen. So now it is also better to appreciate that a patient with normal lungs will have a much higher oxygen if we are going to increase giving them oxygen. So just to tell you the concept of this thing, room air have 21% of oxygen, right? I think very easy to remember. It's general knowledge, by the way. So basically, when we admit the patients in the hospital, sometimes we give them extra oxygen. So what we say, for example, we call it as FiO2, or fraction of inspired oxygen. So for example, like remember this level is the one which is in the room air. So remember this thing that if like you are a normal person, so what will happen that if your lungs are normal, you are normal, and I'm going to give you extra oxygen, so of course your levels will be increased, right? So the easy way to remember this thing is what, that uh, at sea level, okay, I'm not talking about higher altitude, I'm talking about at sea level, and if the person is healthy, the expected partial pressure of oxygen in the blood is roughly 10 points less than the fraction of inspired oxygen. Okay, like this is, you can say, a rule of thumb. A rule of thumb is like a rough rule, right? Or in clinical settings you can think about this thing. For example, I will give you example like this thing. uh, if like someone is on room air 21, so make it 10 point less. How much is the oxygen, normal oxygen? 11. Okay, so what if I will give you for example extra oxygen, you are in the hospital, and I will give you fraction of inspired oxygen of around 40. Now it is more than the room air, right? I am giving you 40% of oxygen. So if the lungs are normal, guys, if the lungs are normal, my point is, if the lungs are normal and you are giving someone 40% of oxygen, so how much should be pKa? Like if you will give 40% of inspired oxygen in a person whose lungs are normal, remember his expected uh, partial pressure of oxygen will be around, somewhere around, you can say 29 to 31, right? See, what I did, like I just decreased 10 points, less than that. So for example, if you started giving someone 100% oxygen, okay, the person is normal, the person have a healthy lungs, and I started giving him 100% of oxygen. So how much will be his blood level of oxygen? Around 89 to 91. Okay, so remember, it's a rule of thumb that the expected partial pressure of oxygen, or the level of oxygen in the blood, is roughly 10 points less than the fraction of inspired oxygen, right? So it is therefore sometimes impossible to interpret this thing, especially when you don't know the patient, or when you don't know the clinical status of the patient. Okay, but of course, when partial pressure of like this level is below 11, or is lower than what is expected, this shows that the person has some lung disease. And nowadays, by the way, there is COVID everywhere. See, and COVID patients have pneumonia. So maybe you will find a COVID patient who needs 40% of oxygen to maintain this level. So normally when we give 40% of oxygen to anyone, in the normal person with normal lungs, we expect this level. But if you are giving 40% of inspired oxygen and you are getting, like, they have this level of oxygen in their blood, so it means like they have some lung disease, right? So that's the important thing, guys. Very important to remember that if the oxygen level is less than expected, okay, and you know like how much oxygen they are inhaling, this shows like they have some lung condition. Okay, so this thing is important. So remember, always interpret this value in context of this thing. Okay, so this thing is very important, right? So if you had a good concept of this thing, and simply like anyone whose uh, this value is higher, but the level of oxygen in the blood is lower, it means like they have respiratory failure. And when you will go and you will go in internal medicine, you would know like there are two types of respiratory failures. Type 1 is that one in which like the oxygen levels goes down, by the way, less than 8, okay, and carbon dioxide is normal. Okay, so type 1 is when oxygen level is less than 8, but this value is normal. Then there is type 2 respiratory failure, in which this level is down and this level is up. So simply in type 1 respiratory failure they just have hypoxemia, whereas in type 2 respiratory failure they have both hypoxemia with hypercapnia. So one way to remember is this thing, what like type 1 respiratory failure just give abnormality of one gas, whereas type 2 respiratory failure give the abnormality of two gases. Okay, so of course there are different causes of respiratory failure. For example, type 1 respiratory failure can be caused by pulmonary edema, pneumonia, pulmonary embolism, and type 2 pulmonary like respiratory failure can be caused by COPD, respiratory muscle depression, and all this stuff. Okay, so this thing is important. And now the second step is we assess the acid base balance or acid base status. Okay, now remember we go systemically in this one, and of course like first of all in the acid base determination thing, first of all you will look for what you will look for pH, right? For example, I will include one slide, quite simple, quite easy to understand. See, whenever we are going to interpret any one acid base status, what we do, like the first thing we do is like we check for the pH, right? So see, if the pH is normal, like within 7.35 to 7.45, or the pH is low, which is less than 7.35, or the pH is high, which is more than 7.45. So this is acidosis, this is alkalosis. Okay, so remember that abnormality of the pH can be due to different problems, like can be due to respiratory problems, okay, or can be due to kidney problems, right, or the problems of metabolism. So whenever the problem is respiratory problem, we call it as respiratory acidosis or respiratory alkalosis. Whenever it is due to other metabolic problems, we call it as metabolic alkalosis and metabolic acidosis. Okay, so now of course like our body have a very good mechanism to bring the pH in the normal values, right? So remember, like whenever someone is going into respiratory acidosis, okay, the kidneys, they try to compensate. Whenever anyone is going into for example metabolic acidosis, the lungs are those which try to compensate. So remember, like the body have a very sophisticated hemostatic mechanisms that attempt to correct the pH. So we call it as compensation, right? So that's why for respiratory problems, the kidneys are those, or metabolic compensation is there. But for metabolic problem, basically respiratory, or you can say lungs compensation is there, right? So this is how we look for. So one of the slide which I can put here as well, again to mention this thing, or to tell you like how we can interpret this acid base abnormalities is you can see over here I'm putting two slides, right? So now the important thing here to understand is what the important thing to understand is number one is pH, right? So you can see, like first of all look at pH, right? So of course, like if the pH is acidotic, you will go in this line. If the pH is alkalotic, you can go in this side. So basically whenever, first of all, we always look for pH, and if it is acidotic, for example, or if it is alkalotic, for example, the second step is to look for simply the carbon dioxide level, right? So assess the carbon dioxide level. So you have to see now if the carbon dioxide is less, normal, or more. Okay. So carbon dioxide, by the way, to tell you a little more in detail, or to tell you exactly why we are talking about carbon dioxide here, because remember, one of the things that the carbon dioxide is an acidic gas. Okay. And if you know that reaction of carbon dioxide, that carbon dioxide plus water is equal to carbonic acid. I don't know like how many of you know that thing. It is uh, uh, carbon dioxide, uh, carbonic acid. Okay, so if you will see over here, it's a simple equation, uh, very very simple equation. Carbon dioxide plus water is equal to carbonic acid. So if the pH is acid, okay, if the pH is acid and the carbon dioxide is high, okay, so the problem is if the pH is acidic and the carbon dioxide is high, so the problem is respiratory acidosis. Okay, but if the pH is alkaline and the carbon dioxide, you can see, is low, the problem is what? Respiratory alkalosis, right? So see, uh, first of all, look at the pH, then look at the carbon dioxide level, right? And after that, we go for and we see like how about bicarbonates or HCO3. So again, we see like either it's low, it's normal, or it's high. Okay, so you can see over here like it's low, less than 24, it's normal 24 to 30, or it's high, more than 30. So now you can see like uh, what is bicarbonate, by the way? Same like carbon dioxide is acidic, remember bicarbonates are alkaline. Okay, so remember like that some people take sodium bicarbonate to combat stomach acid, right? This is the way to remember, like it's a base or it's a alkaline thing. So now if the pH is alkaline, okay, if the pH is acidic, okay, if the pH is acidic and the bicarbonates are low, the problem is what? Metabolic acidosis. And if the pH is alkaline and you check the bicarbonate and you found it is high, okay, so it is what? It is metabolic alkalosis. So simply, guys, see, the thing is not so hard, rather simple. Look at the pH, either it's acidotic or alkalotic. If it is acidotic, assess the carbon dioxide. If it is high, it is respiratory acidosis. If it is normal or low, then assess bicarbonate. So if the bicarbonates are low, then it is metabolic acidosis. Same thing with here. If the pH is alkalotic, see the carbon dioxide. If it is low, it is respiratory alkalosis. But if the carbon dioxide is normal or high, then you have to check for HCO3. If this one is high, it is metabolic alkalosis. So after that, we look for the compensation. Okay. Now, many of the time of the patients, they have just one abnormality. For example, just respiratory acidosis or just metabolic acidosis. But sometimes they have combination of abnormality. For example, sometimes they may have combined respiratory as well as metabolic acidosis, or sometimes they have like the mixture of two things. So that's why we look for compensation. So as I told you before, the body it always attempt to compensate the pH abnormality, right? And it is highly regulated. So respiratory compensation occurs whenever the problem is in the metabolic pathway, and metabolic pathway compensation occurs whenever the problem is in the lungs or in the respiratory pathway. But one thing, guys, remember that see, you get metabolic acidosis, so your pH is less. Now your lungs can quickly hyperventilate. Your lungs will, or you will breathe fast, and when you will breathe fast, what will happen? Carbon dioxide is going to blow away. So one concept you have to remember in this regard is what? Respiratory compensation, okay, is faster than metabolic compensation. Okay, and one concept you have to remember is what? The body never overcompensate. Okay, the body never overcompensate. Okay, the body never overcompensate. So whenever the problem is in the lungs, the metabolic compensation is there. Whenever the problem is in the kidneys or metabolic regions, the lungs are going to be to do the compensation. So now the body will never it never overcompensate. And the other thing which you have to remember is respiratory compensation is faster than metabolic compensation. Okay. Okay. Now the important thing is okay, I will tell you, for example, in acute metabolic acidosis, the body will do what? uh, the lungs will hyperventilate, and the body will get rid of extra carbon dioxide, right? So simply to move the pH toward normality. But for example, if someone have chronic respiratory acidosis, okay, now of course, like the body will compensate, but how it will compensate? So a respiratory acidosis means what? The carbon dioxide, there is more carbon dioxide in the body because the lungs have some condition, some problem. So what the body will do now? The body will start holding more and more bicarbonate. Okay, so the body or the kidneys will start adding more and more bicarbonate in the system to compensate the extra carbon dioxide, right? So this is what happens. So I think you understand this thing. Respiratory acidosis. Okay, so it can be so see if, like I will explain you this thing. Look at pH, look carbon dioxide. If it is high, initial diagnosis is respiratory acidosis. So remember this thing, guys. Now when the carbon dioxide is high, okay, so what the body will do? Simply the body is going to add up more and more bicarbonate. So your initial diagnosis of respiratory acidosis, now you will assess bicarbonate. You found that the bicarbonate are high as well. So the final diagnosis is respiratory acidosis with what? Metabolic compensation, because the body is adding more and more bicarbonate to compensate the addition or to compensate the more carbon dioxide, right? So this one is respiratory acidosis with metabolic compensation. Okay, but if the bicarbonate are normal, the final diagnosis can be uncompensated respiratory acidosis, like the body maybe will start compensating soon. But if you will found that the bicarbonate are low, like in ideally it should be high for the body is compensating, so we call it as mixed acidosis, right? Same thing with this one. If the carbon dioxide levels are low or normal and the patient is acidotic, now look for the bicarbonate. Of course they will be low. The initial diagnosis is metabolic acidosis. So then we will check the carbon dioxide. If the carbon dioxide is low, okay, which should be the case, like of course the body will compensate like this way. So the final diagnosis will be metabolic acidosis with respiratory compensation. And if the carbon dioxide level is normal, it is uncompensated metabolic acidosis. And same thing here, carbon dioxide you assess, like when the body is alkalotic, you assess carbon dioxide. If it is low, then it is respiratory alkalosis. But after that you will assess bicarbonate. If carbon dioxide is low, of course bicarbonate should be low for the compensation though. So the final diagnosis is respiratory alkalosis with metabolic compensation. If it is normal, uncompensated. If it is high, mixed. Same thing here. If the body is alkalotic and the carbon dioxide is normal or high, you will assess the bicarbonate, which come back as high as well. So your initial diagnosis will be what? Metabolic alkalosis, sorry. And then you are going to look for the carbon dioxide levels. So when the carbon dioxide levels are high as well, so it means the final diagnosis is metabolic alkalosis with respiratory compensation. Or if the carbon dioxide level are normal, then it is uncompensated metabolic alkalosis. So the thing is easy, just you need this concept, that's it. So Now there are different causes, respiratory acidosis. You will you can see in Guyton, or you will see like study again when you will study like in internal medicine, or this acid base balance will never leave you. They come again and again and again. But simply respiratory acidosis occur most of the time due to respiratory failure. I already told you the cause of respiratory failure. It could be type 1, type 2, and it could be pulmonary embolism, pneumonia, and all the stuff. Respiratory alkalosis, on the other hand, it is always due to hyperventilation. So, what are the conditions in which we hyperventilate? In anxiety, in panic attack, we hyperventilate. Okay, sometimes in stroke and sepsis as well. So, metabolic acidosis. Now, this is quite tricky. Uh, like there are many causes of metabolic acidosis. So, what happens? Like for example, I will tell you that in renal failure, there could be metabolic acidosis. There could be uh, poisoning from salicylates, or in diabetic ketoacidosis. Okay, all this one can lead to metabolic acidosis. So simply there is a lot of causes of metabolic acidosis. So to narrow down our diagnosis or our list, we go for anion gap. Now anion gap is something I can show you here. Uh, anion gap can be calculated by this way, that anion gap is simply we add the cations, which is sodium plus potassium. If sodium and potassium, they both have um, positive charge, right? And then we subtract them from all the anions, which is chloride and bicarbonate. Okay, so see, to calculate the anion gap, we must have sodium, potassium, chloride, and bicarbonate levels. Okay, so then we can calculate this thing. So if the anion gap is high, so it means like the acidosis is due to presence of excess acids in the body. Okay, so now what is this? The story behind this thing, guys? Simply remember this thing: sodium and potassium, they are positively charged. Chloride and bicarbonate, they are negatively charged. The blood keep their net, you can say, net charge, that is neutral. So what happens whenever there is any addition in the blood which is unseen, which we cannot measure? So for example, if there is too much proteins in the blood, now proteins are negatively charged. So of course what will happen, to maintain that charge in the blood, the net charge as negative 0, either the body will add up more cations, or either the body will lose anions. Okay, so what will happen, the anion gap will be increased. So simply when the anion gap is high, the acidosis is due to excess acid in the body. So high anion gap shows that there is excess acids in the body. Okay, so this is very 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 important thing. So normally, for example, if the patient have, you can say, 136 millimole per liter of sodium, 3.5 millimole per liter of potassium, 100 millimole per liter of chloride, and 24 millimole per liter of bicarbonate. It means like if you will calculate all these values, the answer will be around 15.5 millimole per liter. Okay, so whenever there is metabolic acidosis, we always go for a anion gap, and then we see either there is any addition of acids in the body. So remember, in diabetic ketoacidosis, there is acids are adding up in the body. In renal failure, in lactic acidosis, in salicylate poisoning, in methanol poisoning, all this one can lead to high anion gap metabolic acidosis. And metabolic alkalosis, simply guys, metabolic alkalosis is like can be seen in many patients who have excessive vomiting. So in our tummy, if you know, like HCl is present, so whenever someone have excessive vomiting, they lose their HCl, and they become like their blood pH become basic. So you can see, like you can say, like this metabolic alkalosis can occur due to excessive vomiting, though it can also occur in primary or secondary hyperaldosteronism, hypercalcemia, sometimes by the usage of diuretics, and some very few times bicarbonate ingestion, or you can say increased bicarbonate ingestion, right? So of course, like I'm not going in too much detail of all these things. Why? Because acid base balance, you are going to study the clinical side of this thing. Of course, I was talking from the diagnostic point of view, like how to interpret and what are the things which we can take help from. So thank you so much for listening, guys. I will see you in the next lecture.